Hemorrhoids are swollen veins of the hemorrhoidal plexus, a normal anatomical structure present in the anal canal that is involved in mechanical protection against the passage of stool, gas, and fecal continence and venous drainage of the anorectal region. Whenever the connective tissue that supports the anorectal region is compromised, hemorrhoids become clinically detectable. Internal hemorrhoids can be classified based on prolapse grade according to the Gallagher scale. Grade 1, bleeding only, without prolapse. Grade 2, prolapse that reduces spontaneously, with or without bleeding. Grade 3, prolapse requiring manual reduction, with or without bleeding. Grade 4, prolapse of irreducible hemorrhoidal tissue. Countless minimally invasive techniques are described in the literature, such as elastic ligation, coagulation with infrared radiation, cryotherapy, bipolar electrocoagulation, laser photocoagulation, sclerotherapy, and radiofrequency ablation. The study included 116 patients, of whom 76 were men. The patients' age ranged from 30 to 88 years. To analyze the correlation between adverse effects and the number of elastic bands placed, the patients were divided into two groups, 1 or 2 and 3 or more elastic bands. ERBL ranged from 1 to 6. 84 patients had 3 or more ligatures performed during the same procedure. 24 patients did not present any immediate complications after the ERBL procedure. 57 patients did not present late complications after the LE procedure. 39 patients reported feeling cured after ERBL, and 61 reported feeling better. It shows that there was no significant correlation between the number of ligatures performed and the pain intensity score. There was no significant association between the number of early complications of ERBL and the number of bands performed. Pain intensity after endoscopic band ligation of hemorrhoids according to the number of bands placed. There were also no significant differences between the groups in the assessment of pain intensity. No significant differences were observed between the two groups regarding the number of late complications. The endoscopic elastic ligation method proved to be feasible, safe, and efficient for the treatment of grade 2 and 3 symptomatic hemorrhoidal disease. The technique had moderate rates of immediate and late complications, but most of the complications were considered of low magnitude, easily resolved and without clinical repercussions. The vast majority was satisfied at the end of the treatment with the ERBL procedure. There was no significant difference among complications such as pain or bleeding between patients who had 1 or 2 compared with 3 or more rubber band ligations in the same procedure.